Hello and welcome everyone to the November summary of the various journals which have been published in the last month. So we'll be doing a brief review of the major articles with the major finding. The more in-depth analysis of 4 papers will be published subsequently. So coming first to the article on prevention of VAP by probiotic. This was published in the Journal of Antimicrobial Agents. In this, they looked for prevention of VAP in mechanically ventilated patients who presented with multiple trauma. The intervention included 10 days of therapy in which patients were randomly assigned roughly 100 patients into a probiotic group and a placebo group. The probiotic group received this formula in a sachet. One sachet was given through the Riles tube and another sachet was applied in the oral cavity. And in this, they found significant reduction in the incidence of VAP as well as in terms of ICU discharge and use of vasopressors. Now, the next study is Aspirin in COVID-19, the recovery trial. It was a major study with almost 14,000 patients. They included hospitalized patients with COVID-19 and the ratio was 1:1. They gave 150 milligrams of aspirin once daily until discharged. And they found no significant difference between the two groups. So aspirin was not found to have any benefit in patients with hospitalized COVID-19. The next study is an important study which was a phase 1-2 trial on multipotent adult cells for ARDS. In this, they basically were looking for the safety and tolerability, and in this they found that multipotent adult progenitor cells were safe, well tolerated in ARDS, and the clinical outcomes warrant a larger study which will look into the therapeutic efficacy and optimal patient population. The next review is basically on mortality in ARDS. They looked into the cause of irreversible hypoxemia as a indicator of mortality in ARDS. And here they found an important thing, that is the mortality due to severe hypoxia in ARDS has significantly declined over the years. As you can see over here, in the ARMA trial, the mortality was quite high, but gradually as our ARDS care has improved over the years, by 2010, the mortality has significantly reduced. Now, this has important correlations because future researchers should consider testing therapies that do not specifically target just oxygenation, or if they are just targeting oxygenation, then they should use a large pragmatic trial so that it can detect differences when the mortality has reduced so low. The next is the early treatment of COVID-19 with a neutralizing antibody. In this, they found high-risk patients with mild to moderate disease. There was a reduction in the disease progression and no safety signals were indicated. So this therapy can be utilized in patients with COVID-19 with mild to moderate symptoms having high risk. Again, COVID study on effect of interleukin drugs and signs of cytokine release syndrome. In this, they found IL-6 and IL-1 inhibitors did not shorten the time to clinical improvement in this particular population. This is again an important meta-analysis which was published on the vitamin C, steroids and vitamin B1 use, that is the HAT therapy. This was a component network meta-analysis and a systematic review. The important finding was that metabolic resuscitation with vitamin C, glucocorticoids and thiamine was not proven to reduce long-term mortality. However, the network meta-analysis and the components of network analysis suggest an association of high dose and very high dose vitamin C with the decreased mortality with low certainty. Therefore, glucocorticoid therapy was associated with decreased duration of vasopressor support and ICU use. So further RCTs are definitely warranted and justified to evaluate the role of vitamin C. This is a review on fungal infections in ventilated patients with COVID-19 from the French centers. In this data pool, they found 15% incidence of fungal infections in patients who got ventilated for COVID-19. The effect on mortality was highest with age, solid organ transplant, proved COVID-19 associated pulmonary aspergillosis, and candidemia. Now, the risk of developing the fungal infection was again highest with age, dexamethasone use or the use of tocilizumab, and a longer duration mechanical ventilation, which almost reduced the risk by 2 times. This was again a meta-analysis on the role of hemoperfusion and blood perfusion therapy in COVID-19. In this study, they could not find a single study which was good enough to be included in a meta-analysis. So the conclusion is that we need more better studies to be done to get a idea on the use of these things in COVID-19. The next study is immediate versus gradual advancement of the goal of enteral nutrition after an elective abdominal surgery. So immediately achieving the highest goal vis-a-vis gradually increasing the goal. This was a study coming in from the Asian countries. In this, they did find that immediate advancement was having adequate or similar effect as gradual. However, gastrointestinal complications were higher in the immediate group and no other benefits were observed. For this reason, since this trial had a non-inferiority design, this study was not sufficient and immediate advancement in enteral therapy cannot be considered as a clinical directive. We need a superiority trial or we need more benefit to be proven before we can use immediate enteral therapy in surgery patients. The next is mechanically active compressive depression versus standard mechanical cardiopulmonary resuscitation. In this, it was found that mechanical CPR was similar to standard CPR in terms of the hemodynamics. This is again an important study which did an analysis on the mortality and clinical characteristics in multisystem inflammatory syndrome in children, which has been associated with COVID-19. There have been studies from US and UK. So this was another study which was trying to found the mortality and the clinical characteristics. In this, the mortality rate was significantly higher compared to the previous trials, almost 9% versus 1.8%. And the clinical characteristics were also slightly different compared to the UK as well as the US trial. The next is prostacyclin in COVID-19. Again, this was being used to treat the endotheliopathy, but then it was not associated with significant reduction, and the point estimates, though however favored the prostacyclin group, a larger trial may be done in the future. The next is a very important trial, that is the esophageal pressure monitoring in ARDS, that is the EpiVent-2 trial. It looked at the effect of survival of esophageal guided PEEP titration compared with empirical high PEEP and how it differed in terms of the multi-organ dysfunction severity. The independent multi-organ dysfunction PEEP titrated to transpulmonary pressure closer to 0 was associated with greater survival than more positive or negative values. Now, this finding warranted a prospective testing in a future trial. This is a very significant trial and it did show the benefit of something which we have been trying to do over the years, that is the titrating a low transpulmonary pressure by esophageal pressure monitoring. The next study looked at the extubation technique in ICU. In this, they compared the traditional extubation, that is removing the ET tube by applying continuous suction through the ET tube during the entire process, vis-a-vis a positive pressure group where they were giving a positive pressure of 1510 during the cuff deflation and extubation. That is, they had attached the ventilator and with a positive pressure they were extubating the patient. Now, despite the trend towards the positive group showing better outcomes, it was not statistically significant. However, the findings do agree with the literature that the positive pressure extubation is a safe procedure and can be done. However, till now, we know that both the techniques can be done. We have not really seen the superiority of the positive pressure extubation versus suction during extubation. Thank you for your patience, and check our OTT platform for the various courses